Welcome to True Health Tuesday, and the truth will set you free. Try and find truth on carpal tunnel, shoulder rotator cuff problems, golfer's elbow, tennis elbow, okay? It's mind-blowing. Okay, I even found one of the guys that on YouTube that's doing the electric tape thing for carpal tunnel, wrong. And it's like, dude, okay, so what we're going to do is lack of critical thinking. And this is rampant throughout our society. What did they used to call it? And I mean, stuff like if you have a hammer over your toe, you're not going to let go of the hammer. What was it? Common sense. That was it. Okay. God, I'm glad you came up with that, sir. Okay. Yeah, common sense. Okay. It's so rare now, but we're going to talk about common sense. The challenge is we just got our first video censored. So, you know, it's kind of exciting. So, you know, we're going to find other avenues, but let's just look at this. Theodore Roosevelt. Our government, national and state, must be freed from the sinister influence of control of special interest, exactly as the special interests of cotton and slavery threatened our political integrity during the Civil War. So now great special businesses' interests too often control and corrupt men and methods of government for their own profit. We must drive the special interests out of our politics. Politics, what about media? Do we have a controlled media? Yeah, you're talking about 80% of the funding is through the pharmaceutical industry. What about the funding for the medical schools? Okay, those are the distribution arm for the largest industry in the world. So you're going to get a little bit of a different perspective if you look at science. And if anyone says any kind of science is settled, that is so ignorant. You know, I mean, just equate that with any other type of science in the world. Math, we got everything down. We know exactly what's going on. Engineering, we've already designed the best stuff ever. You know, I mean, none of it makes sense. So what we're going to do today, we're going to concentrate on lack of critical thinking. And I want to bring in, what was that common sense thing? Okay, I know it's rare. Okay, about shoulder injuries, elbow injuries, and wrist injuries. Basic stuff. We're going to talk about the biomechanics, anatomy, and physiology of probably the most missed cause ever. Because I'm looking at Google Scholar, and there's a lot of data points there that support that the body is smart and will heal. But when you look at the critical thinking in the medical world, there isn't any. I mean, it's ridiculous. So an idiopathic disease means they don't know what causes it. And so we're going to go over the actual cause, according to the Mayo Clinic and most medical professionals out there, of carpal tunnel syndrome, golfer's elbow, tennis elbow, and rotator cuff problems. Iatrogenic, it means it's actually caused by it. And you'll see most of the therapies that they use can cause problems. So we know that if you treat an adaptation, so now it's carpal tunnel syndrome, shoulder rotator cuff problems, elbow problems, an adaptation to loss of healthy integrity of that tissue. Yeah, it kind of sounds like it, doesn't it? So if that's true, what do you think's causing it? Don't ask that, okay? Because we just want to go into the therapies. Because if you're actually going to ask what causes it, you might want to address the cause instead of just the symptoms. So let's look at what the Mayo Clinic, and you know, it's pretty much a consensus of ignorance. Rotator cuff injuries. Okay, now this is the humerus. I'm going to show you details of what it looks like. It's held inside of a little tiny socket called the labrum, okay, by these muscles. And they're called rotator cuffs. Okay, and now these muscles, the one that's injured mostly is the topmost muscle called the supraspinatus. And they do some activities, okay? They move it in, out, and whatnot. But it's interesting because if these muscles get weak, it doesn't fall out of the socket, it falls up. So let's look at what the cause is. Rotator cuff disease now, okay, may be the result of substantial injury to the shoulder, progressive degeneration, wear and tear of the tendon, repetitive overactivity, heavy lifting, prolonged time period may irritate or damage the tendon. What are the risk factors? age, sports, construction jobs, and family history. Gee, a genetic component. Okay, we see that all the time. Now, does anybody know anyone that is old, works hard, plays a lot of sports, family history, and they don't have a shoulder injury? Okay? You know, so obviously there's something weird here. Figure, when I was 12 years old, I was a great job. Okay, I'm talking $15 for a half day, $10 for a full day, carrying doors and lumber on construction sites. It was amazing. I was making buck, okay, when you're talking 12 years old. But on this crew, okay, has anyone in here ever seen a plasterer? Okay, I'm talking a guy, you got a flat plate here, wooden stick, he's got a trowel, and he's putting up the mud on the walls, okay, and they got hod carriers, guys that carry this concrete up from the mixer, and they dump it on him, and he scoops it up and puts it on the wall, scoops it up, puts it on the wall. So this is a lot of upper extremity activity. 75 years old, built like a tank. This guy, if you could see him, his arms were like, looked like legs. Okay, and he had two guys running for him. And I'm going, this guy's a beast. And all he was saying, has anyone in here ever worked construction? What do they say? More mud, buddy, more mud, bring the mud. You know, and it's just like, holy moly. So I'm used to working with guys 60, 70, 80 years old that don't have this stuff. So what is the risk factor? Let's look at carpal tunnel. Okay, so obviously carpal tunnel is caused by pressure on the median nerve. There's no single cause in many cases. It may be a combination of risk factors. What are the risk factors? Anatomic factors. Okay, you fractured, dislocated, fall on it. Okay, that makes sense. Sex? No, that's not more, sir. Women, it's more common in women. Okay. Nerve damaging conditions. Okay. Inflammatory conditions. Obesity, alterations in body fluids, such as pregnancy. Well, is there anybody that has these conditions that don't have this symptom? Yes or yes? Yeah, so what's the deal? I mean, it's kind of like saying smoking causes cancer, because it doesn't. There's a lot of people that smoke out there that don't get it. It's like saying vaccines cause autism. No, it causes brain inflammation, but not everybody that gets vaccinated gets autism. So what's the contributing factor? If we're talking about brain damage, if we're talking about, autism, we know the heavy metal poisoning and other contributing factors. So let's look at the contributing factors of this. Now, how many people have heard, oh, it's from the mouse. I use the mouse too much. I use the computer too much. Have you heard that? Okay, scientific evidence. It's possible working vibrating tools on an assembly line for prolonged repetitive flexing of the wrist may create harmful pressure on the median nerve. May, so it's not true, because some people can work that way. Scientific evidence is conflicting. These factors haven't been established as a direct cause. Several studies have evaluated where there is an association between computer use and carpal tunnel syndrome. However, there has not been enough quality and consistent evidence to support the extensive computer risk as a risk factor for carpal tunnel. Isn't that something? So it's not that. I'm going to show you what the cause is. So, double crush injury. And this is going to be one of the missed factors of every rotator cuff injury, golfer's elbow, tennis elbow, and carpal tunnel syndrome. It's a double crush injury beginning in the neck, leading to compromised nerve supply. Now, when you look at this mechanism of injury, what they're doing to find out if there's a problem. Now, you might think taking an x-ray of the neck and looking at the anatomy of the neck, because all the nerves that supply the arm come out of the neck, you might want to look at, I don't know, what do you think? The neck! Okay? Nobody is! It's so mind-blowing. You look at expert after expert, and it's like, good God. I mean, I can draw the brachial plexus from memory. Okay, and these guys aren't even looking at it. And what they're doing is they're doing nerve conduction velocity studies where they shove a needle up here, a needle down here, pass an electricity through to see if it's compromised. But they're not looking at a compromised nerve on the inside. So this one, further, the double crush injury syndrome predisposes to bilateral carpal tunnel syndrome and may be an important prognostic factor. Okay, again, now this is the journal. Hand surgery, British and European volumes. Here's manual therapy, double crush injury revisited. and they're saying 7 out of 10 were highly plausible. So they're seeing it over and over again. But what they're not looking at is blood supply, nerve supply, and appropriate biomechanics. I haven't seen that. So what's golfer's elbow? Okay, now we've got the humerus coming down here, and the humerus comes down here. No, it's not really funny. Okay, but you got a bone on the inside, bone on the outside. There's the medial epicondylitis, there's the lateral epicondylitis. Okay, nobody got the humerus bone? Okay, so when you flex, okay, you squeeze your hand like this, that's called flexors. Those attach on this side, the medial epicondyle. So what do you think you do more of the day? Do you think you do more flexing or more extending? I know, you're a parade wave person, okay? We do more flexing during the day, okay? So this is why medial epicondylitis is the most popular. But also, when we look at this, we've got muscles on this side and muscles on this side. Strength ratio should be about 5-4, where the flexors are a little bit stronger than the extensors. But interesting, what's the risk factors of golfer's elbow? Racket sports, throwing sports, weight training, forceful, competitive occupational movements such as construction. Older than 40, competitive activity at least 2 hours a day, obese, a smoker. You put cigars in there, shit, I hit all of those. Okay, now let's look at tennis elbow. Okay, what is it? Driving screws. Okay, cutting up cooking ingredients, particularly meat. I mean, who comes up with this stuff? No, put that hamburger down, for God's sake. You'll hurt your elbow. Okay, occupations. And you look at this. Where is the appropriate biomechanics? So now let's look at the anatomy and physiology involved and the therapies that are actually going to fix it. So what kind of things come from the neck? You're looking at headaches, asthma, breathing problems. The phrenic nerve comes out of this area. 97% of all headaches come out of there. But also we have the blood supply. You've got a heart here. Okay, that pumps blood out of this opening of the thoracic. It's called the thoracic outlet. So if there's any problem, like, I don't know, say this. I know you're the person on the right, but you work with that person on the left, don't you? Okay, you see her at the coffee. Okay, now this is putting compression on the blood supply, nerve supply that supplies the upper extremity. Okay, this is hugely important. Now, this is absolute evidence of a trauma. Now, let's look at the difference, and this is how doctors can actually diagnose it, because doctors are not critical thinking in this. If you have a problem with the joint, it's going to be in the joint. That means, ow, hurt here. You're not going to say, ow, my shoulder hurts here, and it goes all the way down my hand. That's called a nerve compression. Just had a guy that says, yeah, my doctor says my hip is really bugging me, and it goes just like this. And I said, no, that's the second lumbar nerve root. You're going to have a problem at the thoracolumbar junction. Sure enough, he did have it. So we look at this, the location of where the symptom is going to show you the location on the body. Okay, and so a lot of people are saying that it hurts right here, and they've been diagnosed with rotator cuff injuries. I said, no, that's C5, C6, the most common area of degeneration. You have a problem in the neck. And they'll say, it doesn't hurt in my neck. No kidding. 90% of the nerves that come out the spine, there's no nociceptive firing. There's no pain fibers. So to look for pain is really not that smart. So let's look at the structures involved here. You got a clavicle, and in fact, look at this. This arm has 18 muscles that attach it to this bony rib cage. It's almost like a crane coming out, where your rib cage is solid to protect the heart and lungs, and then you've got this appendage that comes out that can do all these things. It has one bony attachment called the clavicle, but 18 muscles. So this baby, when you move it up and around, you got the scapula moving up and down. But also you have the nerves that come out of the base of the neck there. Okay, and this is hugely important. Now, what if you add this in there? Okay, I know, I'm talking to a group with common sense. Okay, so when you look at this and you think, obviously, someone has to pay attention to the structures of the neck, obviously. This is why 80% of the time, if they do surgery in one wrist, they're going to do it in the next wrist within 5 years. Okay, so we have to look at the real cause. Now, this is a series of x-rays, but what I want to get the doctors that are watching this is to expand their consciousness to look at the whole friggin' body. It's called holistic, but it's underneath that, what's that rare thing? Common sense. You have to look at the whole structure, because obviously, if there are people that can do activities and not get that, then you're missing the big friggin' boat to find out what's the underlying cause. Does that make sense? Nod your head. Good job. Okay, so when we look at this, on the right side here, okay, that's called a reverse neck curve, a reverse cervical curve. We see it all the time. But in order to get a reverse cervical curve, that person had to have torn and injured the posterior longitudinal ligament. Now, based on the amount of damage on the injury there, okay, or the bony distortion, we can gauge the minimal amount of time. It takes 3 to 5 years to see a bone change on x-ray, so we can go in there at a report of findings and say, hey, look, you tore a ligament in your neck over 20 years ago. Could have been 30, 40 years ago, but based on the amount of damage, you can find it. Now, next to that is a person going like this. Why do we do that? To see if we can freaking fix it. Because if it's been out of place, misaligned, distorted, I want to be able to tell the person, hey, the discs are still moving, we can fix it. But then, how about looking at the overall body? It's kind of hard to see on that small one, but this body is off to the side like this. So if you know that 18 muscles guide that scapula up and down the rib cage, if you have a structural deviation like this, do you think that's going to negatively affect the biomechanics of the shoulder? I know, we're talking just basic common sense. Why it's not in the medical world, I don't know. But it's not in the chiropractic world either, because I'm looking at every type of video out there and not one person's talking about the double crush injury or the biomechanics of the whole thing. I mean, if you want torture, look at the vitamins for this. Look at the supplements, the anti-inflammatories, the injection, the surgery, all of this other stuff. It's just psychotic. The postural muscles, the muscles that run down either side of your spine, you do not have conscious control over. They increase in tone under nerve pressure or proprioceptive responses. So once your head goes forward, instantly those muscles are tight. Instantly. So this means that if someone has chronic tight shoulders, do you think they have a problem with the neck? I know. You in the back, sir? Duh. I mean, it's like, no kidding. And so when you see this posture, what do you think they're going to have? Numbness and tingling in the hands. But also, let's look at something else, okay? What about the breathing issues? What about blood pressure issues? All of those come from it. Bursitis. Now, this is going to be all over the place. How many people have heard put ice on bursitis? Okay, that's crazy. Okay, how many persons have said put heat on bursitis? Okay, that's smart. Okay, but let's look at why. Okay, because what is a bursa? So you got muscles attached to bones via a tendon. Now the tendons cross joints. This is why you can move these things. Okay, all these muscles that move this are down here. Okay, except these tendons cross these joints. Now, if I keep doing this, like let's say I'm playing a guitar or, hell, I could barely play a radio, but when you look at this, you keep doing this, okay, it would catch on fire just from friction, right? So around each one of these tendons is a little sac filled with fluid, and it's called a bursa sac filled with bursa fluid. Good, thank you for playing. Okay, so you're seeing this thing, and it makes sense. But what happens? Now, where's the blood supply come for the wrist, the fingers, the elbows, the shoulder? Where does the blood supply come from? Okay, the heart, out of this little opening. So if your head is forward, you've got compromised blood supply and nerve supply. So what happens? Those bursa sacs start to get compressed. They can't fill up with fluid. And so then you get the tendon rubbing on it. And so that starts to inflame. And how do you say inflammation in Latin? Itis. So you call it bursitis. Okay, so that means lack of fluid going to the bursa sac. So, and again, try looking this up. I'm just telling you common sense at what causes bursitis. It's lack of blood flow. Typically, if it's the upper extremity, it's going to be from the neck being forward. There's not people out there saying, by God, if you got bursitis anywhere in the upper extremity, that you got to look for a secondary forward head carriage component contributing to that. Does that make sense? Okay, so now what would happen? The medical therapies for this, okay, they're not completely insane. They're completely friggin' insane. Okay, because you would put ice on it. What does that do? Does that help blood flow to it? No. Okay, or you would tape it up. Does that help blood flow to it? No. How about taking a non-steroidal anti-inflammatory? Okay, that destroys the building block of cartilage and does nothing to help fill up the bursa sac with fluid. And it has no common sense to restore the normal curve of the neck. Okay, does that make sense? So you put moist heat on it. Now, let's see, you take your arm, you put heat on it. Okay, moist heat. Take it away. What color is your arm? It's red because you're tricking your brain. The brain senses that difference in temperature and it increases the blood flow to that area, okay, to equalize the temperature. So we're hacking the brain, we're hacking that biology. But if you put moist heat on your elbow or the wrist or the shoulder, it's going to increase blood flow to that area, increase synovial fluid production, increase bursa fluid production, and it's actually going to fill up those sacs with bursa fluid. Now, let's say you've got an electric-on bursa that looks like you want to pop it with a balloon, okay? Now, is that a problem of blood flowing into it or blood flowing out of it? Out, exactly, because I mean, the blood keeps flowing in there, it's going to go, bam, that's gross. Okay, so when you look at this, it's got valves in there, because it literally has a superfiltrated blood filling it up, and so it's broken. So you can actually create a back pressure on here and start to heal it. So you don't need to operate on it, you don't need to rip it apart, but know that that's been traumatized, okay? Now, let's look at carpal tunnel syndrome. Literally, when we were teaching, or when I was teaching human dissection, you could take a palm, flip it open, okay, and you could stick a dime, you know, on a man hand like this, you could stick a dime in in the tunnel. So it's literally that big around. So it's actually pretty cool. Now, you've got muscles on the front, muscles on the back. Strength ratio is 5-to-4, flexors versus extensors. And what do we use mainly? Flexors. So what does that do? That puts a huge amount of pressure on the bottom, and that could compromise that blood supply, nerve supply, everything. The problem is, what are they going to do? See that white tissue on the bottom on the left-hand picture of the cadaver hand like this? Let's hope it's a cadaver hand, because that would be like really uncomfortable. Okay, they're going to cut that. It's called a flexor retinaculum. And if you look at it, it goes all the way on the front and all the way on the back. Okay, so it's kind of like a tennis bracelet. It holds everything in place. So what's the surgical therapy? Oh, I don't know, cut it. That'll ease pressure off the median nerve. How about we just inject it? That will shrink the swelling of everything. You can only do 3 injections though, because beyond that it starts to destroy the nerves. Okay, it starts to destroy the cartilage, starts to destroy the structures. So right now, with me telling you, okay, the anatomy and physiology that the blood supply and nerve supply come out of the neck. If the head's forward, you're compromising the blood supply and nerve supply. That there's an appropriate muscle balance here, that if you have an alteration in the normal biomechanics, that could put pressure on the median nerve. And so, do any of those solutions or causes say we should cut that tissue or inject it? No, that would be crazy. That's a person that doesn't understand biomechanics. So let's look at this. Here's a patient with wrist pain. Yes, you're looking at a reverse curve in her neck. Okay, with the amount of damage up there, you're looking at plus 25 years. Could have been 30, 40 years ago. Now, knowing that she's had a reverse curve in her neck for at least 25 to 30 years, do you think she's comfortable or uncomfortable? Okay, so what's she going to be misdiagnosed with? High blood pressure, okay, bowel disorders, sleep problems. And so if you've been hurting for 20, 30 years, you're starting to get wrist pain and stuff, don't worry, the shots really helped. It took away the pain. And I'm going, my God, your doctor's an idiot, okay? They're not looking at the real cause. Okay, does this make sense? So this is really common. Now, she still had wrist pain. And so one of her doctors, now you figure she's 65 years old, so her wrist made it over half a century working fine. She's only had pain the last couple of years. And the doctor said, you know, one of them bones is a little bit long. We just got to get in there and shorten that sucker up, and then you'll be just fine. Okay, and I'm going, no, does any of this stuff make sense to anybody other than the surgeon who, I don't know if he has a Mercedes payment, but I mean, this is really stupid. Okay, you get a wrist that works good for half a century? No. So adjust her, she gets better, she's fine. Okay, now let's look at the shoulder. Okay, and this is hugely important because shoulder injuries are diagnosed through an MRI. Inflammation distorts an MRI. Inflammation distorts the MRI. But the computer, because it's a magnetic resonance imagery, okay, is the computer wants to give you a really pretty picture. Okay, so you lay down, so the position, the biomechanics is horrible because you're not standing up under weight bearing, you're not really moving, you got to be still. And inflammation is going to distort it. So you get people that say, yep, it's torn. And they'll come in and they'll say, yeah, my surgeon said it was torn. He says he's got to do an operation on it. I don't know what to do, doc. And I go, it's not torn. Okay, and he says, how do you know? Well, because the supraspinatus does the first 15 degrees of motion. Okay, after that, the deltoid kicks up. So if someone's going, I don't know, man, they said it was torn. It's just messed up, okay? It hurts, I can't sleep on it. And I said, look, buddy, if you're moving it like this, okay, where you got to get it beyond that first 15 degrees so the deltoid could take over, I'm in total agreement. But now, hold your hand by your side, put a little resistance on, and try and pull, okay? If he goes, ah, and can't do it, hey, it's probably torn. If he goes, bam, like this, and can put a huge amount of strength on it, hey, it's not torn. Okay, try it. Go home. Play with your friends. Okay, so when you look at this, we have to change that distortion. See, you've got the humerus going in the socket, and it's held, the labrum, it looks kind of like thin Tupperware, okay? And it's about that consistency, and it's only about like this thick, okay, just like about 3/8 of an inch thick. Now remember, if you've got a problem with the rotator cuff, because of why? Forward head carriage, more than likely, it might be some direct trauma. I've never seen a beautiful curve in the neck, perfectly straight, and any upper extremity issue, ever. I might get a patient in there and I'll go, wow, this is the first time in 22 years I've ever seen somebody with no neck issue and an upper extremity problem. So it might happen. It hasn't yet, but I got my hopes up, because I want those guys to be right. So we're looking at this. We know that humerus, does it fall out if there's a cervical problem or fall up? It falls up. So we've got a superior distortion on that. Now, this is where craziness goes in, okay? Remember, it's jammed up. We want to drop it down and reform the socket. Drop it down and reform the socket. But now, if I'm doing an exercise like this, do you think that I'm helping the nerve supply and blood supply or compromise? Exactly. You got to get the neck curve fixed. Okay, so you got to find out what the problem is. But now, the kind of exercises they're going to give, it's what's called continuous passive motion. And I'm going, oh my God. Do they not know that if there is a rotator cuff injury, that deltoid jammed it in a superior position and has distorted that labrum? Do they not know biomechanics? And then what do? They'll have you walk your hand up a wall to stretch it out. And they'll go, yeah, I couldn't move it like this, and now I can move it like this. And, oh, gosh, I can almost get it up to here. And I'm going, does that feel good? No, it hurts like hell. And I said, yeah, because it's not in the socket. Mellow out, okay? Takes a couple of weeks to get that socket reformed. You do a decent weight. I actually have Minnie's daughter up here. This was back in 2013. She's going into, I think, almost college. I think she's like 17. So there, she's demonstrating. Palms are forward. She's doing the right, correct exercise, dropping it down in place with her chin up. Brilliant. But that's what you got to do. You got to restore the blood supply and nerve supply. So this is impinged on the left, somewhat normal on the right. Now the guy on the left is severely obese. He's not lifting his arm like that. He's just a really large fellow. Okay, but it still does. Even though it angles the scapula a little bit, you can tell pretty darn clear that coming off that choroid process that it should be missing the top of the humerus, not hitting it. So it's pretty clear that that's impingement syndrome. We've got before, okay, it hurt. And we took an x-ray and I said, yes, you have impingement syndrome. But where does this really come from? The neck. Okay, so we're adjusting not just the neck, the entire body, getting his body healthy, because you're not going to have just forward head carriage on a perfectly, biomechanically correct body. So now here's the solutions. What's the solution for rotator cuff injuries? Correct the neck and the thoracic spine. That means you got to take an x-ray, stress x-ray, look at how the body's working. You have to do ligamentous exercises, not strengthening exercises. That means you're dropping it down, you're keeping your chin up. An arm like mine, I need 20 pounds to distract it. And it's going to be butt to the belly, butt to the belly. Okay, so you're alternating the movement. And you have to have your chin up. It seems too simple, but you're getting the neck adjusted and you're restoring that. You do that arm swinging exercise for at least 2 to 3 weeks. Okay, you can do it before. I wouldn't do a lot of overhead lifting because you want to form that labrum first. Okay, once you form that labrum, then you can start to do a little bit more. But within 2 to 3 weeks, you're going to have that labrum start to be fully formed. And if it ever bugs you, you go back to doing the leg swinging to reform it, and it'll be okay. Now, we got to look at the curve in the neck has absolutely essential and a contributing factor to all upper extremity problems. And this is why you'll see double crush injury. But then when you look, if people are evaluating x-rays, they're finding the neck problem. If they're doing an intramuscular EMG study to see or nerve conduction velocity test, they're not going to find it because they're looking in the wrong place. These are some of the other exercises that we do. You could do a towel, and what you're going to do is pull down with only a couple of pounds of pressure to look up, and then when you look ahead, you relax. Now, I've seen this done every way possible. The way we demonstrate it is you pull down with about 2 pounds of pressure, you put your chin up to the ceiling, then you look straight ahead and you relax it. Okay? That's how you do it. Very simple. I've had one person come in, and this was fun as all heck. I've been doing that exercise, and it hurts like crazy every time I do it. And I said, well, that's show me how you do it. I do it just the way you told me, just like this every time. And I'm going, holy sh. Okay, so what do you got to say when you're totally misunderstood? That's not what I meant to show you. Okay? Even though you show everybody the same way. Unless, and there'll be a variation, like if you got a fusion at the bottom, a fusion at the top, there's going to be a little variation, but I'm talking about the average normal human being with a normal messed up neck. Okay? Not surgery, not congenital anomalies, all the other stuff. Also, watching TV like a 12-year-old. Or you could do this on a desk. You put your elbows on the desk, lift your chin up, not back, up, because what's that going to do? It's going to form a normal curve. It's fantastic. You got to get your neck adjusted. Okay, if there is a problem, how do you find out there's a problem? You got to take an x-ray. The chiropractor should be taking an x-ray. And when you're adjusting, the head's not turned hardly at all, because people will come up and say, oh yeah, I'm scared of that neck adjusting. Oh my God, they just whip it around. And I'm going, wow, that would scare the hell out of me too. I've seen way too many karate movies. Okay, the adjusting, the head's turned no more than 10 to 15 degrees. You use one finger, okay, not the middle finger, this finger, okay, and you go along the plane line of the disc with around 2 to 4 pounds of pressure. You can't hurt anyone with that, super simple. Then we look at the solution for carpal tunnel syndrome. What do you have to do for carpal tunnel syndrome? Fix the neck. Okay, then let's say that it wakes you up at night. Now remember, we have a muscle imbalance here. We have compression of the median nerve. One of the tests to see if you have median nerve compression is to go like this. And if it hurts, okay, then you have a problem. The other test is like this, to stretch it, and if this hurts, you also have a problem. Those are both stupid. Okay, don't do them. Okay, because where does the problem come from? Neck. Okay, leading to a muscle imbalance of the forearm. You have a 5-to-4 strength ratio. So if you're only grabbing stuff, you're talking it's overly strong on the flexors. So now this is the best tape, because let's say you got a muscle imbalance of the forearm. What's a great way to make a muscle imbalance worse? That's right, brace it. Okay, so what do they recommend? Bracing it, which is crazy, because what are you doing? You're limiting motion. Okay, it will stop the pain, and then this one surgeon says, well, brace it and then you shoot it with some steroids. Okay, yeah, boy, you're really sharp. Okay, so this is what you're going to do. You're going to use this long tape-like structure that you can get from a hardware store. The reason I like electric tape is because it doesn't stick to fur, really cool, and it opens up and is flexible. You put your thumb and pinky together like this. Now, you've got bones that run down here. Those are called the metacarpals. From here down are the wrist bones, and you could feel them move all over the place. Okay, what you want to be is on the base of the metacarpals. You don't want to be on the wrist. Okay, why? Because we want it to move. So what you're going to do is put your thumb and pinky together like this, and you're forming a hole. And you're going to go around the base of these long bones here, not the wrist. Why am I saying it like that? Because I saw somebody do this incorrectly, and it happened to be one of my colleagues, a chiropractor. And I'm going, holy moly, I should have taught you how to do it. So you put your thumb and pinky together, you put this around, and you don't want to tighten it up too much, just a bit. You should cut it off, don't break it off the way I did, but you should cut it. But see, that forms a tunnel. Well, if I went, see, forms a tunnel. But you can move it around, you'll be able to sleep with it, it's fine. You're not going to need it that long. Okay, we're talking maybe a week, week and a half tops, because you're getting your neck corrected and you're going to restore the muscle balance. How do you restore the muscle balance? Anyone want this? No. We use these, a number 32 rubber band. Okay, it's simple like you can't believe. You can use a hair tie. I just like the number 32 rubber band. Okay, you put your hand like a flower bud and you make it into a claw, flower bud to claw, and you do this to fatigue. Am I doing it correctly? No. Yes. Okay, good. And you do this all the time. And I always say it's not like this. You're trying to scare a small child. And if you try it correctly, it's fantastic, because these muscles go underneath that extensor retinaculum. And if you're increasing the tone of the extensors, you're putting a more appropriate force loading on that carpal tunnel, which forms that arch, and you actually fix it. Okay, so you do this all the time to fatigue. And what do you do when you're all done? You do it some more, because you're correcting a muscle imbalance. Does that make sense?
Yeah. How many times a day? Once a day?
Remember, this is being recorded. I'll ask questions later. You're lucky I like you. Okay, so let's look at golfer's elbow and tennis elbow. Okay, golfer's elbow means that there's a problem with this. Tennis elbow is there's a problem with this. What do you think the problem comes from? The neck. Muscle imbalance, compromised nerve supply, compromised blood supply, something. You got to find it. You got to find a chiropractor that's skilled in working on extremities. Because typically, you're talking over 80% of the time, the ulnar bone is going to go medium. Okay, and that's a very, very simple adjustment. You just have to do it correctly. Okay, and you have to be able to assess it correctly. So, we go over how to assess and correct it. Now, if you want to help with the inflammation, okay, you want to get blood supply to it, because inflammation is a healing process. So you put heat on it and it actually works, okay? It's going to feel better. Sometimes I'll even tell people to put like a neoprene wetsuit material on it, okay, to generate more heat while you're correcting the curve of the neck, and that gets sweaty and slimy. Has anyone ever worn a neoprene brace? Yeah, so you take a cotton sock, okay, cut the toes off, slide the sock underneath and put it over it. So you don't want support there, you just want heat. Does that make sense? So when we look at this, that kyphosis, that rounding over that throws the head forward, has to be addressed. because you're going to see a hyperkyphotic in people that are protecting themselves. See, if there's been a trauma, a problem, throwing the head forward, the nerves that supply the heart come out of the top of the thoracic area. So typically you're going to see a hyperkyphotic person that's actually opening up the nerves, the sympathetic nerve supply to the heart. So that's a protection mechanism or protection action. So this is why you have to check the whole body. Here's another patient, okay? And we're looking, reverse curve, it's higher up. But also, look at the dental work. Okay, are those mercury fillings? I don't know, I can't tell. But I'm sure as heck is gonna ask. Now, at our other clinic in Mexico, we'll do a thermography. So this way you could say, look, you got like 3 root canals, you got some mercury fillings, you had 2 cavitations or teeth removed that were done incorrectly. It's not showing a positive thermographic reading. So you have to take care of it eventually. Right now, it's not a big contributing factor to your ill health. Or, holy moly, you're on fire. I'm seeing red lines coming down. You're in deep trouble. This has got to be taken care of immediately before you stop, go get $200, whatever. You've got to get this thing done now. Now, can you see the low back there? Does anybody on the planet think that you can fix the shoulder, elbow, wrist without correcting the low back and abnormal posture? It's called holistic, but it's just common sense, which is completely lacking. Now, let's say that we have a problem. Keep thinking about this. The automatic nervous system, this keeps you alive. Part of it's located in the neck and the pelvis. The other part's located in the thoracic area. One part keeps you alive under stress. So physical, chemical, and emotional stress are going to activate this one. And that means under a sympathetic dominant state, you're going to be misdiagnosed with low functioning thyroid, gastric problems, slow bowel motility. I mean, just everything. Poor sleep patterns, all of this. So you have to look at the autonomic balance. So if somebody presents with carpal tunnel, and we know it's coming from the neck, and we know the autonomic nervous system have us in the neck, should we pay attention to it? Now the heart has dual nerve supplies in the neck, cranial nerve 10, and in the top of the rib cage area. So can we understand why there is an increased kyphosis in any kind of trauma? Absolutely, because that person is rounding over, opening up the nerves that supply the heart. So this is hugely important. You're going to see this time and time and time again. Why it's missed, I don't know. We look at the Journal of Manipulative and Physiologic Therapeutics. It turns out that adjusting those areas alter blood supply. Journal of Human Hypertension, 2007. You adjust this area, it alters blood pressure. Now, do you want blood pressure low? Do you want it high? Or do you want it normal? Normal. But what is normal? We know one thing, if the doctor thinks he's smarter than you and tends to give you a drug like, I don't know, beta blocker, ACE inhibitor, hydrochlorothiazide, a diuretic, something, that your risk of stroke increases. So if the doctor says, yes, your body's self-healing and self-regulating, except when I think it's not, okay? I know, what I heard, my brother-in-law told me a joke. He said, what's the difference between God and an MD? God doesn't think he's an MD. No. But that's not just for medical doctors. I'm telling you, there's chiropractors out there that think that they're way up there. Okay, he's my boss, man. I got to bust my butt for him. So if you're treating high blood pressure without looking at the cause, your risk of stroke increases. What about this? What about strokes? Do you know that there are actually great studies that show if you increase your blood pressure after a stroke, you lessen the damage to the brain? They're talking about artificially raising systolic blood pressure up to 200. And people will say, oh my God, I was working out and I checked my blood pressure and it was 180. And I said, yes, you're working out. It's okay. Okay, so understand your body is self-healing and self-regulating. What kind of structures are in the neck? Now we're talking about all of this, but if you have shoulder, rotator cuff, elbow problems, golfer's elbow, do you think maybe the asthma is related to it? Or what about the hiatal hernia? Understanding that the diaphragm is a muscle, a flat muscle, and the esophagus pierces it. So if you have a compromised nerve supply in the neck, C3, C4, C5 keeps you alive. That's the phrenic nerve. So if you got a problem in the neck, that could be compromising the nerve supply to the diaphragm, leading to reflux. Gee, doc, do you think that reflux is linked to my carpal tunnel syndrome? I don't know. Let's take a look. But we have to put these in place. What about the cardiac and respiratory center? At the junction, you got the heart here, you got the carotid coming up. At the junction of the internal and external, you got the carotid body and sinus. Now this checks the chemo or carbon dioxide levels and the blood pressure levels. If carbon dioxide levels go up, bam, the heart rate's going to go up. If carbon dioxide levels go down, the heart rate slows down. So we have these sensors in the neck. Is the neck important? Yeah. Then look at it under any circumstance if you have an upper extremity problem. Does that make sense? We're looking at an altered neck curve. No wonder 30 years of loss of curve in the neck. Okay, 30 years of pain, 30 years of a sympathetic dominant state. Is she happy or sad? Now, in what world would you give an antidepressant medication to someone who's shown evidence of a physical trauma of more than 30 years, and that medication, I don't know, let's call it a selective serotonin reuptake inhibitor. Let's say that it has the side effect of suicide, suicidal thoughts, and suicidality, but you're not going to look at the neck, you're not going to look at the body, you're not going to look at any trauma, and this is modern medical care? Good God, man. That's mind-blowing. Mind-blowing. Oh, and one thing too, you can see the top bone in the neck on the right, the normal, C1 is a circle. So when you look at the side, can you see in between my hands? No. For you to see in between my hands, I would have to turn my hands. Okay, does that make sense? Now the brain doesn't stop at the skull, it extends. There's an oblong section in the middle of the brain. Oblong section in the middle. How do you say that? Okay, your medulla oblongata. Thanks, Doc, for stealing my thunder. Okay, medulla oblongata. Okay, it's just doctors use Latin stuff because we sound a lot smarter. Okay, so, but you look at the one on the left, that's literally C1 spun off to the side. And this is surrounding the brainstem. So do you think that's an abnormal pressure, an abnormal force loading? Absolutely. So then, sympathetic, parasympathetic. It turns out that if you adjust the neck, you help with the parasympathetic. You adjust with the thoracic area, you balance out the sympathetics. I mean, we're talking just basic common sense. Now, degeneration is not hereditary. Okay, and even though the CDC, actually says that there may be some genetic components. Really, okay? So go back 10 generations and show me how your family had high blood pressure, fibromyalgia, chronic fatigue syndrome, inflammatory bowel disease. Wait, I know they wouldn't have it because they ate nothing but organic, those wackos back then. Okay, I know that's all they had, but let's look at this. It's mechanical distortion and an adaptation. This is not degeneration, even though it's called degenerative disc disease. This is called osteoarthritis. Itis means inflammation, but osteoarthritis is a non-inflammatory arthritis. So all the stuff that a doctor's going to tell you, you have arthritis, it's not a disease, it's not degeneration, it's an adaptive physiologic response. When we look at Kirkcaldy and Willis, and this is like the biomechanics Bible, they're checking every joint from old cadavers, young cadavers, compression forces, torsion forces, everything. And they're finding out that old joints work just as strong as young ones. And I'm thinking, you bet your butt, okay? Because I remember when I'm 12, I'm envying this 75-year-old tank of a man. God, I love that. I mean, I still got like 16 more years before I'm up to that level, so I got some training to do. Understand that in a normal curve in the neck, of course that's got forward head carriage, the joints are stable, they're working correctly. In a loss of curve or reverse curve, the discs can't get their nutrients, so they get closer. And the body is going to distort that bone in order to stabilize it. But let's look at craziness. Why would you inject a steroid? Why would you take a non-steroidal anti-inflammatory? Those interrupt proteoglycan production, the building block of cartilage. Tylenol is not a non-steroidal anti-inflammatory. Does anybody know how it works? Because I really wish you could tell somebody, because if you look up clinical pharmacology, it says unknown. We don't know how it works. It's not a non-steroidal anti-inflammatory, but we know it destroys building block of cartilage as well. Okay, and accelerated bone destruction, according to the American Journal of Medicine. Okay, but also psychological, emotional problems, gastrointestinal problems, skin problems, blood cancers. 1 in 3 Americans take this garbage, okay, and it's about 56,000 emergency room visits a year. It's the leading cause of liver failure. Journal of Hepatology says, why are we using this? Okay, and honestly, since we've gone over this, does anybody have any good logical reason why anyone would be prescribed this? Anyone? Anyone? Bueller? Okay, so let's look at this. Loss of curve, normal curve. Now, this is interesting because this guy here, he was actually, let me see, it's not extreme, acro yoga. Okay, now I grew up thinking that yoga is like a religious meditative state. Okay, this is acro yoga. It's like extreme meditation, you know, power napping. Okay, so you got one person with legs up here and you're holding their waist like this and they're holding your waist, and then you do cartwheels together. Okay, I mean, it looks bizarre, but I don't know if you'd call it yoga. But he got a trauma, okay, and so reverse curve to normal curve, reverse curve to normal curve. And I know you're looking at the dental work on this saying, my gosh, that's a lot. Is that causing an inflammatory response? Possibly. Here's a guy that's interesting. So we're looking at a reverse curve in the neck plus 20 years of damage. Okay, yes, that's on the upper portion of the neck, so we know the cardiac and respiratory are impinged. On the lateral lumbar, the side view, the middle picture, you can kind of see a shadow of a tube coming down. Okay, can you see that there? That's called atherosclerosis. Okay, that's hardening the arteries. Now, cholesterol drugs actually increase hardening of the arteries. Blood pressure drugs increase hardening of the arteries. Okay, we shouldn't see this at all. Okay, because if we can see the descending aorta, that means all his friggin' arteries are hard, and that's not a good thing. Then I'm looking at his upper thoracic area, and sure enough, he's got a rotation in there, cardiac arrhythmias. And I said, buddy, you've got a lot of stuff, and we'll be able to help you. No, I'm not going to let you touch me. I'm going to have to get my cardiologist opinion first. And I said, I'm not working on the heart. I'm working on the nerves that supply it. He's not working on that. No. He's my doctor. Okay. So, I mean, it's just, we're in a sea of ignorance. Okay, let's look at the real problem, find the cause, respect our bodies. This is a natural anti-inflammatory. Inflammation is how the body heals. It's not a pathology. It's from tissue damage. You give antioxidants, and this means that if you scratch yourself, the body is going to create things called free radicals that can damage healthy tissue. This is why fresh fruit, fresh vegetables, everything is actually really good for you. Not because it's an anti-inflammatory, but it makes inflammation work so that you can heal your tissue. Okay, berries, I'm telling you, if you want a really good dessert, get some avocado, okay, big ripe avocado, put some coconut milk in there, a little bit of vanilla, a little bit of sea salt, a little bit of cacao in there, and grind that sucker up, put some cacao nibs on it, a little bit of sea salt, and you got a chocolate pudding that you will not believe. Sprinkle some frozen blueberries on there. Yeah, and you can say, go on kids, eat it up. It's an avocado. I mean, it's good. It's ketogenic. It's fine. It's delicious. Okay. Natural vitamin C. Get it from fresh fruit. Of course, it's got to be organic, you know. Vitamin E, sweet potatoes, all of this stuff helps. You're not going to eat healthy berries, fresh fruit, bananas, plant-based to solve carpal tunnel. Okay, carpal tunnel syndrome is a signal that tells you that there's a problem. You don't want to cover it up. Why? Because if you got a problem here, and a problem here, guess where the problem probably is? Okay, and the neck is really, really important. So these are the red flashing lights to tell you there's something not right. Vitamin A, sweet potatoes, broccoli. I mean, it's just eat right. Can you see why when we talk about this, you have to get your nervous system checked? And what that entails is digital x-rays, heart rate variability scan, rolling thermal scan, surface electromyography, do whatever you can to check every aspect of it. And that, because 90% of the nerves that come off the spine, there's no pain fibers. Exercise. Had a couple of kids today, one with ADHD, which he doesn't really have, because I asked him, I said, okay, do you have trouble playing video games? Do your parents yell at you to get in there and start playing them? Okay, what do you think he said? Come on, Doc. And the parents are looking at him and said, no, he could play for hours. I say, okay, so he doesn't have a problem paying attention, just paying attention to what other people want. Okay, so let's get him to run around. Okay, let's not label him. Let's realize that he's a child, and so if he goes running around, he's going to have more fun and he's going to sit down and play a bit more. So exercise is vital for brain function. Plus, if you move, you stimulate the cerebellum, and this controls the frontal lobe. The frontal lobe is depression, anxiety, bipolar disorder. Does that mean that if you have an alteration in structure that can develop those types of problems? Yes or yes? Okay, proper nutrition. Just, if man makes it, you don't eat it. Sufficient rest. Change your circadian rhythms. We got enough videos on that. And power meditation. No, prayer and meditation. It just makes sense. You can control your emotional state. You change the chemicals your brain secretes. Now, next week, I'm not going to be in Mexico, okay? I'm actually going to be at this summit. I think I'm speaking on the 19th. I'm speaking about 2 hours. It's going to be available online, so if nobody wants to go to Overland Park, Kansas, hey, garden spot of Kansas. No, I heard it's actually really pretty. And so, it's online, but this is going to be fun. The guy who I want to see, okay, is Dan Sullivan is really, really good. And Deed Harrison, if you've ever seen him, he is rocking. This guy is like a nerd's nightmare. He's just brilliant. He'll talk over and over and over about all this technical data, and it's just, you could just nerd out in the back with me. I'm going to be speaking for about 2 hours on neurology, chiropractic, and how to fix the body. Extreme health. Get there. Get on the forums. Okay, there's enough people that have had enough problems that have all the solutions. If you have had any chronic disease, I guarantee there's somebody on these forums that has had the same thing. We're still November. I think there's like two cabins left or 2 rooms left. That's in November, and I'll find out next week if it's continuing education, but I think we're going to be able to get around 8 hours of continuing ed there too. And then the cruise next year, and we redid this. Now, any questions? I can take 3 questions. Good. Next week, okay, we're going to do lower extremity. So we're talking hip bursitis, knee issues, foot issues, and you're going to find out the greatest way, and this is called return on investment. If your spouse, if your sweetheart or anything is having a tough day, male or female, this isn't romantic, just give them a foot massage. Okay, go in there. It's a way to express it. I have a couple of patients. One had a stroke, and so he's not real stable, and she's taking care of him, and she's also taking care of her mother-in-law, who's like 95, and so this gal is stretched to the max, and no one's really listening to her. And I said, buddy, just a 5-minute foot massage, and you're going to make her day, and just say I love you. Okay, so let's go out there. Let's take care of each other. God bless you.
Amen.